introduce the next stage, the innovative projects that were selected, together with the other ones that we will listen to later on from all over the world. Projects in order to solve the COVID-19 problem. So I'm going to introduce all of these projects with a special guest we're going to introduce with this video. Giorgia Palmas. Hello, Giorgia. Hi, Cosmano. Good afternoon, everybody. Good afternoon, all the guests that are connected with us. Good afternoon. People are following us not just from Italy, but also from all over the world. So your voice will be translating to English as well, but you're calling from Milan, right? Yes. I'm calling from Milan, from my home, where I am, of course, locked up in since a month or so, following the rule, applying for everybody. And I've been listening very actively to the previous speech. It was very interesting, the impact of e-commerce and the fact that we are experiencing a very difficult time, a tragic period of time from many points of view, but a period of time that can be an opportunity for us. And the opportunity starts from awareness. The awareness of how we've been living so far and how we will choose to live from now on by complying with rules today and setting new rules for tomorrow. Yes, that's true. We can do that. And we can also hope that these innovative projects will be implemented because they can really solve the coronavirus problem. So together we will present 2016, we've introduced WMF Day, the startup competition. Now we're going to do something very similar because these are also very innovative projects and we're going to present them in a different way because you're at home and I'm here. So remotely. But let's see, we've got new projects, new startup projects, and there are 9 projects. They want to support, they want to help in this coronavirus emergency and support all the people that are involved. So, Cosmano, if you want, we can start straight away with the first one, the first startup company, which is PagineMediche, medical pages. And we will have Antonella introducing the project. Antonella, are you there? Can you share your screen with us, please? Here she is. Please switch on your mic. So, we've got a short delay, but we can hear you. Yes, we can hear you. I cannot see you, but I can hear you. Can you see my presentation now? Yes, we can. I can see, yes, we can all see it perfectly. PagineMediche. So let's start with the first startup project for today. We're very curious about it, about your project. Just 1 second, Giorgia. I'm gonna be a human countdown. After 3 minutes, I'm gonna stop the presentation, okay? Okay, perfect then. PagineMediche is a digital health platform with over 2 million users every month, which aims at connecting doctors and patients. So we wanted to be active in order to face the COVID-19 emergency. This is why we made our platform available with a set of innovative services. First of all, we've developed, starting from the government guidelines, an info chat, which really simulates a conversation with a doctor and makes it possible for patients or people to understand what the right behavior is based on the indications we get from our government and from the healthcare system. So you get correct information without overloading telephone lines, and you get medical help in order to understand also who people have to contact to get in touch with, the local physician, for instance, or the regional emergency number, and so on and so forth. 100,000 people have already interacted with our chatbot. Our project is part of the Solidarity project, is sponsored by the Lombardy region. The region also uses this platform to gather information, to gather data. So we help in the epidemiological and retrospective analysis in order to cope with the COVID-19 emergency. For suspect cases, for patients who have symptoms but are still at home, there is a monitoring service we have implemented in order to support healthcare professionals and families who need some monitoring and some support. So we have clinical reports for every COVID patient, which is shared with the doctors, containing different parameters in order to better manage the case remotely. And as soon as these parameters get to a threshold value or they overcome the threshold, some alerts are sent to the physician who can possibly activate a video analysis or inquiry with the patient. And this is a service that we extend it to all of the Italian physicians. So they really have access to our platform and they can use our service free of charge to visit their patients via web, via hub, and everything's reliable. Of course, it's GDPR compliant as well. And everything in a very short time. So 1,400 patients are currently managed with a video visit inquiry. So this is it. Thank you very much for your attention. Thank you, Antonella. Thank you. Giorgia, what did you say about this project? Well, Cosmano, I have to say it's very interesting for many reasons, because in a time where we're literally bombed with suggestions, rules, indications, having a direct connection with our doctors to understand what the right behavior is, then this is very good, not just for symptoms connected with the coronavirus, but it's a direct connection that makes this application very interesting. I think that the next speaker has already established a connection for the second project presentation. Alessandro De Carlo, can you hear us? Your mic, you have to switch on your microphone. Alessandro, we can see you, but we can't hear you. You have to switch on your microphone. Since this part is very short, very quick, please make sure you are switching on your microphones. We can now hear you. Okay, can you hear us? Yes. Perfect then. Giorgia, I would suggest to start with Alessandro's project. There's some lag, I have to say, and some echoing. Maybe you're using another device as well. Okay, now it's good. Okay, go on. You've got 3 minutes time. So Limbix is the project name. So we use it in companies. And what do? We try to bring psychophysical health and performance for certain companies with virtual reality. And this will be important in the aftermath. We are a group of professionals from the university. Most of us are university professors, and we brought this technology to Italy, Limbix. It's a virtual reality visor that was developed specifically for psychology use. So clinical use, but also performance support use. The features of Limbix are that there is an immersive virtual reality. There are different environments that can be changed depending on the use. And it also makes it possible to use 360 degrees maps, so real places, virtualized places. And the professional can also take part in the vision because it can really see what the patient is seeing. So you can have a clinical use, or you can use it in order to increase the performance in psychological assistance or for psychophysical health. So we are trying to disseminate this as a culture for psychologists because we came out with a specific path for companies and for healthcare professionals because they are suffering very much from stress, and therefore we can use it with them to improve their lives. There are 4 sessions, one for deep breathing, and then another one virtual 3 things, positive things of life, then body focus and body awareness, and a 4th session on the best possible self, the best version you can have of yourself. These are the 4 purposes we use Limbix for. The 4 sessions for stress management for managers, but also for operators. And we have, of course, professionals doing this. So we've got a very good performance in terms of productivity and improvement of well-being. We use a technology that is absolutely innovative at a world level. We can use it as a training session, also in terms of funding. We can receive fundings to this purpose. It's a more technical information maybe, but still it is a training activity, and it reduces risks and improves health. So we try, of course, to comply with the Italian legal framework as well. But we mainly help companies to start again with a better performance thanks to Limbix. There's still a lag in your voice, but okay. Next project. Are you going to introduce the next project? Yes. Thank you, Alessandro. Thanks. Very interesting. Very interesting. It's such a stressful moment for healthcare professionals who never stop working. All of the categories, all of the healthcare professionals have been working so far. The third startup company is InsilicoTrials, and Luca Emily will introduce the project. Good afternoon, everybody. Good afternoon, Giorgia. Because Giorgia and Cosmano. I'd like to ask Alessandro to stop sharing, because otherwise I can't share my screen with you. I am calling from Udine. I was skiing when Lombardy locked down, so I didn't manage to get home. I remained in a mountain apartment, and I had a few clothes with me, skiing garments mainly. And so, but I'm breathing a different air, definitely now in the mountains. So, InsilicoTrials developed specific projects, a very specific project dealing with a very heartfelt problem nowadays. So the need for specific treatments for illness and diseases, such as in this case COVID-19. Now we can see the slides. There is a huge problem in terms of drugs and medical devices. So time and costs are huge. 2.5 billion for every new drug and 12 years or 15 years to develop them. We should have a vaccine that should be available, but we are told that we need months or years to get it. Medical devices are also requiring lots of money and years to be developed. In order to tackle all this in a very innovative and effective way, we decided to bring about other approaches to the life science world. So simulation, for instance. This is implemented in industries like the automotive industry, the engineering, aeronautics, appliances, and so on and so forth. So they're using simulations for all of their products. Every new car, every new plane is developed with a simulation. And then just in the end, only in the end, it's tested in the real world. All of the features, so the aerodynamics or structure resistance and so on and so forth, is studied through simulations, with simulations. So InsilicoTrials is a company that can develop this through modeling and simulation, can speed up research and development and regulatory approval for drugs and medical devices. We select models that are made available by research and development companies that are famous all over the world. So, for the approval of drugs and so on and so forth. And we make these tools available to companies in order to speed up R&D activities, in order to cut on testing, developing, and certifying times by 50%. These are some graphic examples of simulations for healthcare. This is a knee joint simulation with a prosthesis, or a stent simulation, or heart implants, valves, for instance, or spinal implants to correct scoliosis. And all of these applications are possible today thanks to the application of simulations before testing them on animals or human beings. So this enables us to reduce implementing time and also safety of the devices themselves, because they can be tested millions of times in computers before being tested in more expensive and slower environments like the real ones. So as to COVID-19, in order to give you a demonstration of what a possible application of the simulation can be, we've made this simulation that really simulates the diffusion of a disinfecting spray agent in a building in different environments. So in the future, when we will leave our houses, we will go back to our offices or to our workplaces, we will definitely need to disinfect the environment, because COVID remains on surfaces for a certain amount of time, or in the air even. Air can be vectoring the virus and particles as well in closed environments, so indoor, and therefore it will be necessary to sanitize the indoor environment. So with this simulation, we can really plan the amount and the ideal positioning of the diffusers in order to reach all of the rooms in a specific amount of time with the disinfecting agent in order to sanitize all of the areas that need to be sanitized. So in order to avoid experimenting in real environments, we can use simulations. We can use extremely developed technologies in order to understand beforehand what we need to do in order to fight the virus and to implement prevention. Thank you very much, Luca. Thank you very much, Georgia. This project is also very interesting. Very, very interesting, because technology can really speed up R&D times, and this is a very important and interesting thing. Okay. We have another project. You want to introduce it? Yes. The next startup company is SoftMining, and we will have Stefano Piotto introducing the subject, the project. Hello, Stefano. The mic, please. Can you switch it on, please? Okay, some seconds, and Stefano will for sure switch on the microphone. I'm going to invite all of the startuppers, well, that's not the proper definition, but the innovators, please, they can share the screens, but don't switch off your microphone, please. Okay. So, Stefano, you can start with the project straight away. So, SoftMining is a startup company using artificial intelligence to for drug design, so to develop drugs. We've been using our technologies to do something different, though, because we had our problem, which is very well known. There is the infection of COVID-19. So 2 weeks ago, we developed an app which traces people's contacts. In order to do this, we needed to have a privacy compliant approach, of course, if compared to the approaches that we use in Korea, for instance. So there's no geolocalization, there are no private data, sensitive data that are used, and just phones are used in order to monitor the contact and the duration of the contact. So basically, it's based on Bluetooth. Possibly, you need a GPS in order to monitor these contacts. Every 60 seconds, mobile phones perceive and detect people around it, and this data are saved regularly on a database which the authorities can access to. And so when they make a test, for instance, they can even record it in the app, and the information will be shared in the network. So everybody will have this information available on the smartphone. And this is important for two reasons, because individuals can, of course, be more responsible and adapt their behaviors in terms of contact with their relatives or colleagues. And also for the healthcare professionals, this app is very important because with this information, they can more effectively monitor possible infections. All of this information is then processed in order to avoid further infection. It's a way to estimate, to plan, and to forecast infections, future infections. And of course, then we'll need to go back to normal production, and therefore we will use it also in the future. The app is already available, it's open, the codes are available for the healthcare institutions. During the second stage, we will need to start again a new thing. For instance, this is a port, a harbor for a factory, for instance. You can detect the areas where you have more risk of infection, or you can understand which employees among all of the employees can run more risks, and therefore they can possibly stay longer at home. So this was thanks to SoftMining, but also to other friends who helped us, Nexus, Trucky, and Push Up, which I'd like to thank. Thank you very much, Stefano.
Thank you. Quite an interesting project. Traceability, well, our enemy is a virus, and tracking and is really important to contain infections. Yes, of course, and we've been talking a lot about China, and in China, an app was created right from the beginning, but I think that also in Italy we have lots of creativity. Let's move on to the next project. The name of the company, of the startup, is Yape, and the speaker is Sara Bergamaschi. Okay, I hope you can see my slides and you can hear me. Good afternoon. Our company is named Yape, and I have a short video to introduce our company. Yape is a way for smart delivery, and actually it can be used both indoor and outdoor, and we can deliver both post but also food or drugs throughout cities. Safety is very important to us. The software is based on algorithms that ensure safe stop and obstacle avoidance so that our system can overcome fixed obstacles like posts or people walking in the corridors. For example, it is a two-wheel vehicle. It can spin, but it can also change direction in a very narrow corridors. It uses a smart software. It can communicate, in particular, with the smart buildings. so that delivery is completely independent. Yape has a specific application for the recognition of the recipient of the parcel. Yape consists also of the two elements. It is a software platform I have already mentioned, and also a control room through which we can monitor it. So there is an operator who can monitor it, and in case of need, actually the droid can be controlled remotely to ensure that delivery is done in safety. So what kind of solutions do we offer? Well, we first try to contain as much as possible people movements within cities. And secondly, we try to avoid human contact, offering a delivery service which is based on a no contact service. As you have seen from the video, Yape is a very flexible solution because you can use it in different settings, and you can also deliver in different types of products from food. But considering the current situation, Yape can also deliver drugs and medicines to people in quarantine who cannot leave their homes, and so it is quite difficult for them to get drugs. This is it. Thank you. Thank you, Sarah. Very fascinating project. We know that social distancing is the keyword, and as Christian Sachi said, e-commerce has a huge impact on the environment. Yape is electronic, and so I think it also has a zero impact on the environment. It is very nice indeed, and very useful during this emergency, but not only. Let's move on to the next project. We have Sara Notar Giacomo from HUxelerate. Hello, Sarah. Okay, so in order to talk about HUxelerate, I would like to start from the rationale, from the reason why we created it. Well, we wanted to make of every computation efficient in terms of performances, energy consumption, but also times needed for data analysis. And the idea was to increase computational efficiency in quite an easy way. This is very important if you have lots of data to be analyzed or managed, for example, when it comes to genome, because often traditional technologies are not effective, and it is not possible to get results in a very short term. And we know that today this is very important. We know that researchers today are developing diagnostic technologies in order to reduce the time needed for diagnosis. And we're also trying to develop solutions to contain the virus. When it comes to our process of research, well, of course, we have to consider the computational complexity of analyses, starting from diagnostic, but also considering the genome sequencing, but also imaging. We know that in terms of computational power, well, it requires a lot of that. We know that also when it comes to the search for vaccines, well, today we need really supercomputers worldwide, and we need resources to be made available to research. So the computational issue is a problem indeed. So what we do is to use our technology to create ad hoc computational solutions so that researchers can access computational solutions which are very specific and enable them analyze a lot of data. For example, when it comes to COVID-19, we made our solution available, genomic, which consists of two main sections. First of all, the applications which are used by researchers, which are already ready to be used and they are already accelerated. And also, we have a library, so a lot of functions which can actually boost our custom applications. We can accelerate what our scientists are using. And also, it is a cloud-based technology, so it is easy, accessible, and it does not require important investment in terms of dedicated infrastructures. Thank you, Sara. Thank you for your presentation. We often say that time is money. Well, actually, today, time is life, is survival. So, shortening diagnostic time, well, this is very important, in particular in the situation we are living today. And actually, we really wanted this project to be known also abroad. We wanted to promote and give visibility to these projects also abroad. I think we have the next speaker connected. We have Claudio Celli with us. Hello, we can hear you. Claudia from Pazienti.it. Okay, so Pazienti.it. IT is a hub. We offer a comprehensive experience to our users who usually search for health-related topic, and they can also talk to a specialist. Let me show you data. From March, 2 million people connecting to the platform, and we have people of any age. So users can contact a specialist from any place and from any device. And this is especially important for people having symptoms, and so they can talk to a physician to get a general, let's say, picture, general information, a general opinion. And then, of course, they can also talk to a second specialist. Or, as you can see here from this example, given the health emergency we're going through, we are using the platform a lot for people suffering from chronic illnesses. So in this case, practitioners can monitor patients through our platform and can monitor also the compliance of the patients. Of course, it goes without saying that this type of service is highly requested. And 1 month ago, we launched also an initiative of digital solidarity, allowing all people with the symptoms to get in contact with a pool of specialists free of charge. And we are really proud of this because we are supporting hundreds of people who every single day need to talk to a physician. And actually, we see that digital technologies can actually remove barriers when it comes to healthcare. This is it. Thank you, Claudia. Well, once more, removing barriers, in particular given the emergency we are facing, this is a great opportunity But I hope that all this will continue in the future, because these type of technologies or these type of applications can be used also in the future. Talking to a practitioner, we can do that digitally, at least for a first opinion, for a general opinion. So this is kind of a lesson we can learn, which is exploiting digital technologies as much as possible. We have been talking about this with some of the speakers. I mean, the use of digital technologies has been booming during this time. Now, let's move on to the very last project, the Italian one, and later on we will have speakers presenting projects from all over the world. Now we have a last speaker, Valentino Megale. He's already connected with us. Valentino from Softcare Studios. Hello to everybody. Softcare Studios is a startup working in the digital healthcare industry. Our mission is to improve the quality of life of patients. We use virtual reality in order to help patients go beyond and overcome the limits caused by disease or during hospitalization. I have to say that we are living kind of a unique moment, and all over the world we are at home, and we are all facing the lockdown. Social distancing is needed in order to contain the spread of the virus. But this situation is perceived as negative or unnatural, but for a lot of patients with chronic diseases, well, this is just routine, this is normal life. So in 2017, we created Tommy, a project for pediatric patients in order to help young patients go beyond the walls of the hospital. This is for hospitalized patients. They can visit digital spaces. They can really reinvent relationships with their parents in order to, of course, reduce anxiety and stress during treatment and therapy. And over the next months, we will try and support and help patients. But I have to say that now we are all patients in a way. And technology is helping us. The technology is there already. And by using this type of virtual device, we can reach out to faraway places. We can also meet other people. We can take part in conferences in a digital way. So, for example, using AltSpace VR, or we can even make digital works of art using, for example, Tilt Brush by Google, or we can play and have fun with any person all over the world. So my message is that when we have limits, when we can't move, however, we can free our minds, and digital technologies can help us in this sense. The important thing, of course, is how we do use technologies. We must use them with a responsibility, being aware of technologies. We must use technologies to build relationships with other people and to create memories, of course. So we stay at home, but we free our mind. Thank you. Thank you, Valentino. Very interesting because we are all at home But at the same time, we also have to think about patients suffering from COVID-19, but also patients suffering from other diseases. And technologies can help us going beyond the walls of the hospitals. We can reduce the anxiety, the stress, and the fears. And when technology can do that, well, this is really a very important result. And we also launched a lot of initiatives about the fact that we should stop our body, but we should activate our mind because we have to think about the future, the aftermath of the pandemic. Let me tell you two things that I liked the most. First of all these projects are supporting people, are supporting us because we are going through a very difficult and unique time. But at the same time, we also have to remind people to use digital technologies, internet in a responsible way, in a conscious way. We also said digital solidarity. Why is that? Because thanks to the digital technologies, we can shorten distances, we can offer services, and we can fix problems we are facing today. So solidarity, but digital solidarity is the key word today. There is also an initiative from the Ministry of Innovation about digital solidarity, and today we also talk about digital cooperation. Now, before say goodbye, I would like to show you a cartoon made for us. It is both of us and my small little dog. Oh, Polpetta is not actually Polpetta, Sansone, Caco. I have three. I have three of them. Thank you. Thank you, Giorgia, for sharing this moment with us. Thank you a lot.